Well, I lost my husband 11 years ago, and he was in this hospital for 12 weeks, and I basically lived and died in here. And it made me want to give something back to the hospital for what they'd done. Unfortunately, he didn't make it, so I was left with a huge gap in my life, and I thought, well, I always talked about volunteering. I love the whole hospital, believe it or not. If I could bring my bed here and live, I would. I mean, everyone will tell you that. I tell everyone. I just love the place. There's so much goes on, and I love anything medical. So as I say, I should have been a nurse, but I didn't get there.
My current role in the vaccine hub, I would say the best bit about it is coming in and not knowing what's going to happen. Where I'm going to be working, how many people are going to be in, who's going to be working in admin, which one of the vaccine staff's on. Because you build up a relationship with everyone, so there is that element of unknown. With regard to my role in the patient council, the best part about that is when we can get involved with people, in particular with people who are kicking off new projects in the hospital and being called in as the patient voice to help with forming change and help see it through, giving the patient or the carer a view at every opportunity. It's a real buzz.
I decided to volunteer because I retired roughly, I think it's 6 years ago this June, and I've been along quite nicely, and then COVID struck, and you were trapped basically at home, and I wanted to put something back in and help the NHS if I could. I know it's only a very small way, and I like meeting people.
I decided to volunteer because when I retired, I wanted to do something useful that would give me a bit of structure to my week and get me out of the house and enable me to be amongst other people.
I've been with the hospital for 10 years and I love it. I wouldn't be without it, really wouldn't, because I really do love the place. It's my life, it really is.